Welcome to Berkeley Has Speaker Series, New Thinking in the Pandemic, Business, Economics, and Inclusion. I am Pierre-Olivier Gourinchas. I'm the Faculty Director of the Clausen Center for International Business and Policy and the SK and Angela Chan Professor of Global Management, where I research international macroeconomics and finance here at Berkeley. I am joined today by my colleague Barry Eichengreen, George C. Pardee and Ellen N. Pardee Professor of Economics and Political Science at UC Berkeley. Barry is a very prolific scholar. His work on international currencies, sovereign debt, the gold standard, or financial crisis has been hugely influential. In his latest book, The Populist Temptation, published by Oxford University Press in 2018, Barry has looked at the recent global resurgence of populism around the world and placed it into historical context. Today, Barry will begin by sharing his recent research on how the coronavirus pandemic might significantly reduce trust in political institutions and science for decades to come. We'll also discuss how the pandemic may leave long-lasting scars on the next generation. If you have any questions during this discussion, please put them in the YouTube chat. Welcome, Barry.
Thank you, Pierre-Olivier. That was a very kind introduction. Among other things, you reminded the audience that I'm not really a specialist on epidemiology or pandemics. I've worked on the gold standard, on financial crises, on currencies, but it is said that COVID changes everything, and it certainly changed my research agenda, together with a couple of co-authors at King's College London and the European Bank for Reconstruction and Development. We had been working on financial crises, another long-standing interest of mine, and how the experience of a financial crisis affected people's trust in their government. Looking at the experience of 2008, 2009, we strongly suspected that there would be a negative impact of financial crises on trust in government, but then COVID-19 hit and we pivoted in a way to looking at the effect of epidemics on trust in government. Little did we know that this would become a rather prominent, immediate concern. Whether there is trust or mistrust in government could be important for the effectiveness of public policy responses to the pandemic. Here in the United States, as you see in this slide from the New York Times, as elsewhere. And I think this issue is, again, very much in the news at the moment with all the discussion we're having about vaccination, whether a vaccine will be safe, whether we can trust the vaccine that will be rolled out in the last week of October. So I was watching NPR and Politics Monday a little over a week ago and heard this dialogue between Amna Nawaz and Amy Walter about this fight over the vaccine, how it's being rolled out, how much of that is resonating with voters. And Amy responds, I think what Tam brings up is really important, which is how much this virus, this pandemic has been politicized. Everything from whether you're going to wear a mask or not, who you're going to trust, whether you trust the news media, whether you trust public health officials, whether you trust the president, and whether you will trust the vaccine when it magically materializes in the week before the election. So I will speak directly to some of those questions. It's not clear when you think about it whether living through an epidemic, living through a public health emergency like the current one, will have a negative effect or a positive effect on people's trust in their government, in the integrity of elections, and their political leaders. There's the famous rally round the flag hypothesis that people talked about after 9/11, for example, which suggests a positive public response to this kind of emergency. Anger over the failure of our leaders to contain the virus, on the other hand, suggests that the public may respond in a negative way. And in either case, I think we know little, if anything, about how persistent that effect will be. So some people say the effect on trust in government, trust in the integrity of elections, trust in our leaders will be negative. Again, the New York Times asked the question not very long ago, will the coronavirus kill what's left of Americans' faith in Washington? On the other hand, there was a recent survey conducted in a number of different countries by this polling entity, the Edelman Trust, that found that the COVID-19 pandemic had given rise to additional, greater trust in government rather than lesser. So again, there's disagreement even not only about whether there's an effect, but in addition, simply about the direction of that effect. So we can speak to those questions. We now have a set of papers that provides systematic evidence on the question of how trust and confidence in governments and leaders is affected by experiencing an epidemic. And we find that it's affected negatively, strongly, and persistently. That, to me, is a deeply troubling finding. It's troubling because it points to the possibility of a vicious spiral, negative feedback, in which lack of trust in government allows the epidemic to spread, and further spread of the epidemic continues to erode trust in government. I'll say something about how I think one can get out of this mess toward the end. So what we do, what we find specifically is that individuals who experience epidemics in their impressionable years, between the ages of 18 and 25 is the way we formalize it, but really in their late adolescent and early adulthoods, when opinions about things like preferences toward political affiliation, attitudes toward government are durably formed, individuals who experience epidemics at that stage of the life cycle display less confidence in political leaders, governments, and elections. The effect is large. The effect is persistent. We can trace it as lasting for 2 decades, and we strongly suspect it lasts even longer than that. The effect we identify only appears, it's specific to communicable diseases like viruses, for which a timely and effective public policy response is especially important, not for high blood pressure or diabetes or whatever. We find the same thing for confidence in vaccination, that people who experience an epidemic in their impressionable years have less confidence in the efficacy of vaccination and are less likely to have their own children vaccinated. So this change in attitudes carries over to actual behavior. Same result obtains for trust in scientists, and we've heard some chatter about that recently. And the effect happens to be largest for among individuals who experience epidemics under weak governments being least capable of effectively responding to a public health emergency. We're following earlier scholars, a few in economics, but more in cognitive science and sociology and psychology, who have developed this impressionable years hypothesis. So the idea actually goes way back to the 1930s, when there were some pioneering studies of women enrolled in Bennington College. They were surveyed then, and then they were surveyed repeatedly through the 1960s. So it's kind of like that series of movies, 7 Up, that everyone has seen. The opinions that they formed in their impressionable years stuck with them thereafter. This has been understood and explained in different ways. So Carl Mannheim has his concept of the fresh encounter, that attitudes are durably formed when late adolescents and early adults encounter new ideas or events for the first time. The psychologist Erik Erikson developed a theory of identity in the 1950s and 60s, that individuals at this age are especially open to new influences because they're at the stage of life where they are forming their own sense of self and identity. And more recently, there's been work in neurology that identifies neurochemical and anatomical differences between the adolescent and the adult brain that seem to be associated with durable attitude formation. So we build on that literature, but we are skeptical of it as well. So we look for the same impact on people who were younger when they experienced an epidemic, and we don't find it. We look at people who were older when they experienced an epidemic, and we don't find it. This effect seems to be specific to individuals' impressionable years. So what we do specifically is we take data from the Gallup World Polls. Everybody's heard of the Gallup organization. They may not know that Gallup now polls people in 142 countries around the world. And it's been doing that for the better part of 15, 20 years now. And among the questions they've been asking are how people feel about the national government. Do you have confidence in the national government? Do you have confidence in the honesty of elections? Do you approve or disapprove of the job performance of the current leadership of this country? And Gallup tells us other things about the demographic and economic characteristics and status of the individuals who respond to the poll. We pair that information up with data on epidemic exposure. So there's an NGO in the Netherlands, MDAT, that has constructed a database on disasters, including epidemics, which are defined as medical events that cause 10 or more deaths, in which 100 or more people are affected, that lead the government to declare a state of emergency or call for international assistance. And they find 47 epidemics and pandemics being big epidemics since 1970, affecting 137 different countries around the world. So if you look at our epidemic map on the right, you can see that epidemics are disproportionately a sub-Saharan African phenomenon, not surprisingly, but that they have affected, according to this definition, a variety of other countries over time. And our measure of epidemic exposure is the number of affected people in most of our analysis. So we take that information at the country year level and merge it with the Gallup World Polls. This is the only equation I'm going to show you, I promise. What it does is to explain that our dependent variable, what we seek to understand, are those survey responses. Do you have confidence in your government, for example, how an individual polled in a given year in a given country responds to that event as a function of, depending on how many people suffered from an epidemic, whether there was exposure to an epidemic, when that same person was in his or her impressionable years, not now necessarily, but back then. And we also adjust for control for the country that they're in. Country fixed effects means we're only comparing two people in the same country, one with epidemic exposure in the impressionable years and one without. We're only comparing two people in the same year, one with epidemic exposure back when they were in their impressionable years and one without. We're only comparing two people who were born in the same 5-year period, are of the same cohort, one with epidemic exposure, one without. We're only comparing two people of the same age today, one who had epidemic exposure back in their impressionable years, one without. And we adjust for as well a host of other demographic and economic characteristics of the individual. So this is a big and messy table, and I will skip over it immediately. It's for confidence in elections. Another thing that's going to come back on the table in the United States in early November. And the different columns are different specifications with different sets of controls. The key point is they all show the same thing. Exposure to epidemic is the important variable. It is always negative, has a negative effect on confidence in the honesty of elections. The effect is statistically significant. We can, with confidence, say it's not zero, and its magnitude is big. So the first panel of this table is what I just showed you, but only looking at that exposure to epidemic variable. And you can see we find exactly the same thing for confidence in the national government in the middle panel, and approval of the current political leader, not necessarily the political leader back when this individual was exposed to an epidemic. And you can see all the effects are negative. Almost all of them are significant. They are large. We are confident that this really reflects the impact on attitudes, trust in government, of epidemic exposure, because we're only comparing two people of the same cohort, two people of the same age, two people in the same country, two people surveyed in the same year, because we're controlling for the characteristics of countries as well, like the risk environment, which is what international country risk score refers to. And we're controlling for a bunch of other characteristics of the individual, income and home ownership and so forth. The results are general, so they don't depend on the specific epidemic series I showed you. There is at least one other. We use it, we find the same thing. We measure the severity of epidemics in different ways. We find the same thing. We control for growth and inflation and current economic conditions. We find the same thing. We also control for whether there's an epidemic today in the year of survey. We find the same thing. And we look at other institutions like confidence in the military, confidence in banks, confidence in the media, and Amy Walter's conjecture notwithstanding, we don't find anything there. We don't find a decline in confidence in the media on the part of people exposed to an epidemic in their impressionable years. And the effects are large, as I said before. So here we roll forward in time and look at people who were exposed to an epidemic 1 year ago, 2 years ago, 3 years ago, 4 years ago, 5 years ago, reminding you that we're looking at people in a particular 8-year, 9-year age category, 18 to 25 years old. So when you're 10 years out, you're potentially 18 years into the future, 10 plus 8. And you can see the negative effect on confidence in government elections and leaders dies off gradually over time, but it is persistently negative. It doesn't go away after a couple of years. And the effects, as I said before, are limited to individuals in their impressionable years. So I didn't know we were going to find this when we went in, but it comes through really strongly. You can see the negative effect of epidemic exposure when people are between the ages of 18 and 25 when exposed. The coefficient on that variable is significantly different from the red vertical line, from 0. Not so for older people and younger people at the time of exposure, where the effect overlaps with the red line, cannot be distinguished from 0. We then go to a different survey. The Wellcome Trust is NGO in the UK that has surveyed people in a bunch of different countries in 2018 about medical related questions, including whether they believe that vaccines are effective, that vaccines are safe, that they are important for children, and that their own children are in fact vaccinated. So their we have surveys of people only at one point in time, but people of different ages, people in different countries who may have or may not have been exposed to an epidemic in their impressionable years. And again, we find a strong, significant negative impact on not only attitudes toward vaccination, opinions of vaccination, but also actual behavior. Um, Negative coefficients, significant coefficients, large coefficients, once more. And finally, the Wellcome Trust also asked people about their um, attitudes, confidence in scientists. Are you uh, confident that in scientists in general, in scientists working for private companies, in scientists working for universities? Do you believe that scientists working for universities are honest? And if you were exposed to an epidemic in your country in your impressionable years, you're less likely to have confidence in the honesty, integrity of scientists. So I take a little bit of succor in the idea that scientists working for universities, uh, uh, whether they are thought to benefit for the public, that coefficient is not significantly negative, but I worry that all the others are. So that's the bottom line of the study, that epidemic exposure does seem to affect attitudes toward government, toward public health interventions like vaccination, toward scientists and scientific advice. Those effects persist for a long time. I think all that is disturbing because if epidemics reduce trust and less trust makes it hard to contain epidemics, then there's a greatly heightened risk of susceptibility and the scope for an effective public policy intervention based on scientific findings, scientific advice. The availability of vaccination arguably becomes less. I think this is something that we should worry about. There is a literature on scientific communication that talks about how scientists can cultivate trust and convince the public that they're reliable and working in the public interest. I think Anthony Fauci and Deborah Bricks are familiar with that literature. Maybe more scientists should be. So thank you. Let me stop there.
Well, thank you very much, Barry. This was a fascinating and at the same time very sobering presentation, but I fear that many presentations about the impact of the COVID-19 pandemic are sobering these days, whether we're looking at labor markets or health outcomes. I would like to start the conversation by bringing back a little bit what might be special when we look at health crisis of the kind you've studied in the work you showed us, the communicable disease, versus economic crisis that might also leave some scarring effects on people. And there is a body of work that has built up over the years, some of it associated with our colleague, Professor Malmondier at Haas in the economics department, that documents that people live through a very substantial financial crisis may also see their way of looking at the world affected very, very persistently in the way they are willing to take risk, or in the way they're investing their own money, or in the way they're looking at various outcomes. Do we see, in your view, do we see similar, so are these comparable when we're looking at economic crisis versus health crisis? And also I imagine that often those health crises, those epidemics or pandemics may themselves be associated with an economic crisis in the countries where they occur. And therefore, can we think of them as sort of compounding each other, or is there sort of some confounding effect here that we want to take into account?
You're going to have me back in 6 months, because on our agenda is to look at how economic behavior is affected by past epidemic exposure. I read the literature in economics the way you do, not only Ulrike Malmonier's work, but also that of Paola Giuliano at UCLA. that economic crises do have a lifelong persistent effect on attitudes toward risk, for example, on saving and investment behavior. So in a way, that's where we came in. We were interested on how living through a banking and financial crisis would affect those kind of responses. And we got distracted by and preoccupied by the pandemic, just like everyone has. It is interesting to note that the MDAT disaster database has information on earthquakes and tornadoes, and I don't know if they have wildfires. They should. So I think our first stop is going to see whether the kind of natural and man-made disasters that they also have information on elicit the same kind of response as epidemics do. In order to find out more. One more word about that would be that there's a debate now about how long fiscal and monetary stimulus in countries like the US should last, and whether all this stimulus is going to result in excess demand and inflation. The answer hinges in part on whether people's economic behavior is going to be changed durably by the pandemic. So my conjecture is that a lot of people have discovered they don't have enough savings to comfortably survive these kind of episodes. They're going to be saving more and building up their financial reserves. Both corporations, the airlines, which had been buying back stocks, are going to be doing something else in the future. And people who don't have enough savings to put food on the table for more than 4 weeks, 20% of America are going to be saving more as well. And if there's more saving, there'll be less spending, less excess demand, the need to keep stimulus going for a longer time. So there are lots of implications for the economy.
I will come back to the economic implications in a little while, but I would like to stay with the history, historical side for a little while longer. In going through the paper you wrote and thinking about preparing for this this exchange, I was reminded of Eric Jones' The European Miracle work, which I'm sure you're very familiar with, which was arguing that in fact the ability of societies, even back in the medieval times, their ability to handle and to maintain and contain pandemics was actually critical for early stages of development, and may even have, and that may be the more controversial part of his argument at the time, may have been part of explaining why European societies were well positioned for the Industrial Revolution as opposed to societies in other countries. So is in a sense, are we rediscovering vulnerabilities that have been there for a while? And in a sense, do we see how governments and structures of government have been shaped by exposure to pandemics over long horizons? Is there something that you would like to share with us on that?
If you try to understand the origins of the modern states and how state capacity, fiscal capacity, the ability of governments to raise resources and run deficits and borrow in emergencies, that capacity developed, was cultivated in response to two sets of emergencies, epidemics and wars. And I think there's been a lot of attention in the scholarly literature to the wars, less so to the epidemics, although there are a variety of different strands of work in economic history that draw links between, say, the Black Death on the one hand and labor-saving technological change, the decline of serfdom, all the things that were preconditions for the transition to modern economic growth. We've already seen, if you've been perusing the literature, a resurgence of work on the role of the disease environment in shaping economic development and underdevelopment. So clearly, that's back.
Okay, well, that's a fascinating answer. Let me now sort of raise another question, which is if we hear you, and I think what you showed us is very, very convincing, that we have this decline in trust in governments, in leadership, in institutions, in science as well, and the effectiveness of vaccines. Immediate question is what should be done about it? Now, you alluded to this in your final remarks, and I think you indicated that some of the answer could be in the way science and scientists communicate. That would be one leg of it. And then you alluded to another part of it, which is that it could be weaponized. This sort of political response could be weaponized by governments that may or may not want to push for pandemics to be more or less contained, because they might see a political benefit from that. And so here, I wonder also, and I know you've written about this recently in a Project Syndicate column, whether there are also implications of what you're describing for the kind of policies that we need to be put in place on the economic side to maybe contain the consequences of the crisis. You might argue, for instance, that it makes a lot more sense to try to be all out and try to contain this very aggressively early on, with maybe a combination of fiscal and monetary policy, with all stops pull out, especially if you think about the long-lasting effects that this could have beyond just the economic cost, but also the damage to the political fabric. Do you want to comment on that?
There is a lot in that question. First response would be, I thought, have believed for a long time that we need to think in terms of the economic policy response, not only about the immediate emergency, but also how the structure of the economy is likely to change as a result of the pandemic. The US and European countries responded differently in the sense that Europe did more to try to keep people attached to their current employer, which helped with in terms of limiting immediate distress, but probably will slow that process of downsizing the tourism and hospitality and transportation sectors and ramping up healthcare, home care, childcare, and everything digital. So there's a trade-off there between meeting the immediate emergency and facilitating that adjustment. I'm not quite sure how you achieve both at the same time. That's the dilemma. Second observation would be, how do we deal with skepticism regarding the public health response? I think it's useful to remind ourselves of the utility of independent central banks. We need independent government health agencies. In principle, we have them, but we now need to defend them and preserve their independence so that they are insulated from lobbying from whomever and can take decisions that are in the public welfare. And third, there's that literature on scientific communication that I mentioned in passing. If you go back and read it, there have been some limited surveys where people are asked why they don't trust scientists. And one of the answers you get is because scientists are members of the elite. They're not like us. I'm reassured that Anthony Fauci threw out the first pitch at the Washington Nationals game after they started playing again. People are also extremely disconcerted when scientists disagree with one another. When they encounter that, they believe scientists are unreliable because there should only be one answer, or that scientists' personal beliefs are shaping and distorting their advice. So we also need to do better in terms of explaining why there can be valid disagreements, different data sets, different ways of analyzing data sets. These things which are familiar to those of us on this call are not second nature to the public at large.
That's certainly something that resonates and that we are often confronted with as economists in public discourse. Let me actually jump on one part of your answer here and bring in a question from the chat. Someone in the chat is asking whether there is any evidence that there's a decline in public trust towards some of these institutions are specifically made independent from the political bodies. So for instance, Federal Reserve. So do we have, is there any evidence of that sort that you know of or that you've looked at that would be different from the general trust in leadership and political institutions?
No, I'm not aware of in any public opinion polling on that. It would be a fascinating thing to have evidence on, because central banks have been very conscious about the need to cultivate trust amongst the public and rolled out all kinds of communications initiatives, public fora with non-traditional stakeholders, and they have legions of people who try to shape how monetary policymakers communicate with the public, in part to maintain trust in that they're taking decisions in the public interest. On the other hand, we know that central banks are now straying, that's my word, into non-traditional areas like climate change, like income inequality, like racial inequalities in the United States. And the wider the remit, the harder it is to communicate clearly how the policy decisions map into the outcomes. So I don't think I don't think we really know how public opinion has moved, and we should.
Let me bring another question that's also popping up in the chat here, which I think is interesting because it goes towards not just the response to pandemics, but when we think about countries like the US and maybe other countries, it's also somewhat of a, I mean, we can observe somewhat of a trend towards distrusting institutions that started before the pandemic, may be related to the global financial crisis of 2008 in the US or the European sovereign debt crisis in 2010, but may have started even before that. And that's certainly something that's been documented, and I think something that some political parties try, in fact, to capitalize on. And so, in a sense, what could governments do to regain the trust of their citizens, both in normal times and in challenging times? That's a question that was coming up from the chat.
I wish I knew. So for the United States, the data show, Gallup data going way back, show that there's been a secular decline in trust in government, I think since the late 1960s or early 1970s. So this is quite a long-lived phenomenon now. I personally suspect that it is associated with growing political polarization as measured by political scientists. That's a parallel trend. Polarization reduces trust in government because when it happens to be controlled, or part of it happens to be controlled by radically different political party or interest, you can imagine the reaction. But one can also imagine trust in government declining, and that feeding political polarization. So it goes both ways. There's work out there that links growing polarization, and I suspect declining trust in government to the media environment, the echo chamber effect, and we all know how that works. So what can agencies of government and political leaders do about those problems? Again, in the world of central banking, they've responded to this by increasing transparency, and that's an obvious response. But I think part of the noise around trust in government and trust in our leaders that we're experiencing right now in the United States has to do with this, with a perception grounded in reality that not all of our leaders and agencies of government are being as transparent about the situation and the prospects as they might be. I think Bob Woodward might have something to say about that.
I hear you. So I think that the same issues that you document with respect to trust in domestic and national governments, one could raise them also vis-a-vis international organizations. I mean, in a sense, public health is a global public good. The COVID-19 pandemic really makes it very apparent that something that starts in China can ripple through the world, and And so we're all in the same boat. And that suggests that the right level of intervention is at the supranational level to some extent. And we have organizations like the WHO that are supposed to be taking the helm in situations like this. But it seems that, and I don't know if you have any kind of data on that, it seems that the distrust in national governments, there might be an even bigger distrust in international organizations that arise in times like this. Do you have a sense that this is the case? If so, is there something that can be done at the level of the multilateral organizations to try to address this?
It's interesting that the very first significant instances of international cooperation, which go back to the 19th century, were on the issue of public health, precisely on the containment of contagious diseases that were spreading across borders. So the Harvard economist Richard Cooper has a classic paper dating from 1989 on international cooperation in public health. It's clear that with the kind of international transmission that we're seeing now and the competitive scramble for PPE and vaccines, that this is a problem that cries out for a internationally coordinated response. I think the problem is that the pandemic occurs against the backdrop of growing nationalism. Nationalism had been on the rise. Populism, which has a strong strand of xenophobia underlying it, was on the rise well before the pandemic struck. So we were primed to move into an environment where people were skeptical about whether international organizations like the WHO were part of the problem or part of the solution. So what the WHO can do is what it's been doing, trying to establish that they are an honest broker and that they haven't been captured by, convince Washington, D.C. that they haven't been captured by China, and convince Beijing that they're not going to be captured by Washington, D.C.
Well, let me end. We're almost out of time. Let me end with one final question where I will sort of take it from the international back to the sort of the individual level. And I think the title of the series is New Thinking in a Pandemic, Business, Economics, and Inclusion. I want to sort of come back to the inclusion part of the series. And we know that in particular in the US, in the context of this COVID-19 pandemic, the levels at which people are at risk varies greatly across different segments of the population. And we know also that, for instance, with the African American, the mortality rates and or the rate of a severe version of the COVID-19 are very elevated. And so it brings down the question of, do we see different responses for different kinds of population? How do we foster inclusiveness in an environment like this one? What can be done also, and that's a question that was a final question coming from the chat, what can be done also, in your view, at the level of average citizens?
So we have been concerned about whether the kind of responses in terms of trust in government we find are different for better off people and less well off people, richer people, poorer people. And it's kind of hard to cut the data in a meaningful way when you have data for 134 countries. So we haven't gotten very far in terms of that. I think the studies that we've done do point to the fact that we as a society can do something about the problems that are looming, that will confront us about whether enough people will be vaccinated and whether enough people will accept sensible scientific advice and adapt their behavior accordingly. Beyond that, I think we're, very specifically on your question, Pierre, we're going to have to confront at some point, I'm not going to give you a date, the question of who gets vaccinated first and second and third. And one of the issues that we're going to have to confront there is, for example, that discussion will have a racial aspect to it, because we know the incidence of infections is much higher among the Afro-American population than the population as a whole. would it be sufficient to vaccinate the frontline workers first, or do we have to think directly about the racial aspect of incidence? One dimension of that would be what's most efficient in terms of reducing spread and infection. And the other aspect would be what can we actually have a dialogue about as American society? I don't know the answer, but I think we should be thinking about that, all of us.
With this note, let me just thank you very much, Barry, for joining us today and for sharing your very insightful and timely research with all of us. And with this, I will close this meeting. Thank you to everyone who attended.
Thank you.